Hello and good morning, everybody. Thanks so much for being here with me today. I am with the one and only Felisha Norrington. How are you doing, Miss Felisha, today?
I'm good. How are you?
Good. So excited to have you on here all the way from Atlanta. Have been really looking forward to this podcast. Took a bit of a hiatus, revamped things, and ready to get back into it. So thank you for being here with us today. And
And thank you too for having me. I appreciate the opportunity to discuss.
Oh, well, I'm really, really glad and excited for these questions because we're going to get into some really awesome things. And y'all already know we're going to go ahead and start it with the lightning round. So, first question for you is if you could add one class to every college curriculum, what would it be?
It would definitely be a professional development class that helps to build soft skills.
Mm.
That would be, things that are helpful in the workplace, like business writing and, other skills that, you don't necessarily get in your classes.
Yeah, that's actually really cool. And now that I think about it, I feel like Carriaya with our students, that's kind of what we do because
Hmm.
where else are you going to learn like bedside manner, how to
Right.
speak to family members, how to, be in a situation where someone has like a serious illness without actually being put in that situation. That's really good. I like that one.
Right, right, and just understanding what it's like to work in an environment, and what the expectations are, and things like that. That's real key.
Absolutely. I completely agree. On that note, most underrated caregiving skill that's actually a superpower.
Um, the ability to manage a crisis, crisis
Soft
management
skills.
or crisis intervention is something that happens in the workplace, and certainly when you're dealing with somebody who's sick, you don't want a crisis, but there are times where you can't predict things, and you have to be able to react very quickly, and that's a skill that you need oftentimes in many workplaces too. So I think that's one that's underrated that doesn't really get recognized as a skill.
That's actually a really good point because yeah, that's working in stressful situations is something
Mhm.
that will come up throughout your life, and caregivers are kind of dealing with that maybe almost every day.
Yeah,
um, so add it to the resume.
yes,
But
exactly, exactly.
um, and what is one thing you wish someone had told you in year one of caregiving for your mom?
That I couldn't do everything by myself
Mm.
because I didn't really, and I think that's a common thing with caregivers. I think they don't, you don't really realize you're getting into this situation that's going to last longer than you expect it to, and you think, okay, well, I can do this and I can do that, and I certainly had that experience. It was quite a while before I realized, okay, I can't do all of this without some assistance, with a son without some assistance,
Mm.
and you can get stuck really easy in that pattern, which of course causes stress and other things too as well. So
Absolutely.
that's the one thing I wish someone had been um, stayed on me about. There were people who kind of said it, but I was like, no, I'll still be okay. So and that wasn't the case.
There's so much guilt that also goes into
Yeah,
being a caregiver as well that we really don't talk about enough. And the burnout is so real,
yeah,
especially even if it's somebody that you love, even if it's your mom, even if it's your dad, sister,
hmm,
brother, kid. I mean, there's like a lot, can't pour from an empty cup. And,
yeah,
the more that you kind of take care of yourself, the more you're realistically taking care of your loved one as well. Because,
exactly. You can't, because if you run yourself in the ground, then you won't be able to take care of them.
or
Um,
yourself, and
or
that's
yourself, or
so.
yourself. And self-care is just very important
Mhm.
in a caregiver's journey, because you never know how long
Yeah,
that caregiver journey may last.
right.
And the longer it takes for you to realize it, the more impact it's having on your health.
Mhm.
There are plenty of studies that show the effects of caregiving on, long-term effects on caregiving on, caregiver health.
Mhm.
So it's very important that you recognize early
Mhm.
that you need to take care of yourself.
There's actually a thing called the Caregiver Strain Index,
Mm.
and we recently were, you know, uh, approved to do a study with Emory University on the impacts of having respite care. on the caregiver strain index and how it helps with, regulating and things like that. So this goes like right in line with that, and that there's so much that you can do if you take care of yourself first.
Yes.
So yeah,
Yeah, that's
absolutely.
good. That's good. That's good to know because the more research that's done on that, and the more studies that are done on that, the more assistance that can be.
Yes.
Yeah,
And social supports will be put into
yeah,
place for our caregivers because
yeah,
Lord knows we need them.
absolutely, absolutely.
Absolutely. So, Felicia, of course, you are a social worker working in higher education. But you were also your mom's caregiver for 12 years. And so, maybe talk to me about what are the top two or three things that you learned that every caregiver, whether they're a student or a family caregiver, should know?
I think that the one of the top things is making sure that you have an understanding of your family members or your loved ones' condition, so you'll know where to source support from. There are plenty of resources out there for you because that's one of the things that's very difficult to manage as a caregiver, which is where do I find resources? Where do I find um, assistance? And there's lots of disease specific resources
Mhm.
for individuals, but you don't really think of that in the middle of um, caring for somebody. So it's
Mhm.
important to talk to the health team that you have involved, and to build a health team. That's probably one of two things. You've got to advocate. Hopefully, you will have good physicians involved with it, whatever you're doing. Now, I was very lucky for that. I mean, we have a very great family physician, so he was very helpful. But not every care, not every doctor is, like that. Not every physician is like that. So
Mhm.
advocate for yourself,
Mhm.
um, and learn what resources there are available that can help you, and then ask for help
Mhm.
finding them, because what you'll find as a caregiver is you're trying to find the time to contact people and things like that can be a lot. So try to use, get whatever assistance that you need, or ask for the assistance that you need from
Mhm.
people that are close to you. So that was probably one of the bigger things that,
Yeah.
and then also getting an understanding of how insurance works. It's terrible that you have to deal with all of this stuff, but you do
Oh my
have
God.
to. You need to understand about insurance. You know any legal issues like guardianship or all these other things. The more information. Now, I was lucky because my mother was big on end of life planning for her and my dad. So like they had, advanced directives and all these kind of things. But a lot of people don't know anything about them. So
That's great.
yeah,
Yeah, that's the thing that I feel like that's a practical piece of advice that everyone should take right now is have the conversation now, because it's never too soon. I think that these are things that will make you. It's a hard conversation. It's an awkward conversation. You don't want to be like, hey, mom and dad, what do you want to do if X, Y, or Z happens? But it's better to know. I feel like the best thing is to kind of like it always is. It's, even when it comes to like, I talk about this all the time too. Like a lot of times people are afraid of screening tests or even finding out that they do have something like Alzheimer's, dementia, or something like that. They're like, oh, if I don't know, that's better. But I'm like, no, if you find out, then the sooner you're able to kind of help yourself and
right,
intervene and make things better. And it's going to not be great finding out. It's not going to feel good. But then once you
right,
do know, then you have a clear path ahead of you of, okay,
yeah,
these are the steps that I need to take. So yeah, that's a really good piece of advice as well. Is just kind of like planning things out ahead of time,
yeah,
and really like what do your parents actually want? Because
right.
there might be a time where they aren't able to advocate for themselves, and you're their advocate. So it's good to know what their real true wishes are.
Exactly. And as much of that as you can do in advance that is good. But I also tell caregivers, because I have had experiences
Mhm.
where people didn't have that, happen. They didn't have the luxury of having that. And I tell them that's okay. You just have to figure out what to do and make sure you get help. Contact, the resources.
Absolutely.
Ask for help from, your medical team to know where to get started. Because some
Mhm.
people get very upset when they realize that they should have had all this stuff done, that's okay. You still just live
Still
in the moment and do, and that's what's important.
100%. And everybody's on your side. You just need to ask.
Oh yeah.
You just need to ask and start having those conversations. And
Yeah.
I love it. I love all of this.
Yeah.
So I'm curious, how did caregiving sort of affect your career trajectory? And what advice would you give to someone who's trying to balance both caregiving and their career right now?
Well, I was fortunate because my employer was very helpful,
Oh,
flexible in terms of like if I had something to do for my mother, or if any appointments, things like that. That was great. I think the biggest impact it had on my career is that I did stay in Atlanta to take care of her. Like,
mhm.
I'm almost positive that if she was not here and taking care of her was not a part of my life, that I probably would have moved. That was
Mhm.
the biggest thing. Now, do I regret it? No. It's fine, because I don't think that, I've been able to accomplish many things by doing it. By staying here, it's not like I lost an opportunity or anything like that, but I certainly understand caregivers who feel frustrated, because you do get frustrated with,
Mhm.
having so many demands on your time and things like that. So I think, but for me, and once she died in 2013, and once she did die, I didn't regret any of it. Like, I didn't regret not having moved or anything like that. So I'm grateful. Now, for people who are actively caregiving, um,
Mhm.
my best advice is to balance, and it's hard. And I'm hoping that I know everybody does not have a supportive employer.
Mm.
So, but it is, but you have to still find balance between, work, and, taking care of the person that, you love.
Yep.
And then also find ways to develop yourself professionally, where you are. So if you can't move, what else can you do? Maybe you can get a certificate, or, some way to still build you, because you won't be caregiving your entire life. So therefore you need to, still maintain yourself, or find some way to, get you, skills. And that can be challenging too, depending on your, the demands of your caregiving situation. But caregivers should also have respite periods. So find some way to incorporate that into that, so you could still feel like you're accomplishing. That's a big thing. You don't want to feel like your life can't stop just because you're caring. So,
Right. No, absolutely. That's such an important. That should honestly be the title of this podcast. Your life shouldn't stop just because you're caregiving,
there
um,
you go.
because there is an after,
Yeah,
and unfortunately, and as heartbreaking as it is, you're going to be. It's just you in the after,
right.
um, and so that's something that's really difficult to grapple with, because it's the grief of losing someone, but also like even grieving for what your life was beforehand,
Yeah,
as well. And that's something that people will feel guilty about, but it's a completely natural part of the human experience, at least from what I've seen in my opinion. um,
yeah. And also for me, my mother always wanted me to, continue on and go on, afterwards, after she wasn't, if she wasn't here. And
right.
that motivated me a lot,
Oh,
to want to, do stuff when she, but that's a real thing for people. The drop off from having cared for someone for a long time and figuring out what to do next is, a huge part of, grieving and all, that piece of it. But, being, allowing yourself to think about things you always wanted to do, or hopefully you have a relationship with the person that you're caring for, that they're going to want you to the best for you,
right.
want you to go forward, and use that to kind of get yourself out the house, go volunteer or go do something you hadn't been able to do. Those kind, having some kind of goals, and that ties back into the career thing. Keep some goals for yourself
Mhm.
the whole time, so that when that period stops, you can at least have something to focus on, rather than just your, bereavement and, grief period. So,
Speaking of, I do want to give a quick shout out to Miss Felicia, because she was feeling a little bit under the weather today, but she still
um,
came on the show and is putting on an amazing, like giving amazing answers and just being
oh,
authentically yourself. So I do want to thank you for taking the time to be here, even though maybe your throat won't be so happy about it afterwards.
Thank you, thank you, thank you. Yeah, my sinuses turned on me this weekend, so but that's okay. We're gonna get it handled. So
Something's in the air though, because I think when the like seasons change or something like
mhm,
that, that's when so many people get sick. It makes
yeah.
sense, I guess. But yeah, so speaking of like support and support systems, so I know you work in higher education, and you probably thought about this question quite often, but if you had 60 seconds to convince a university president to invest in student caregiver support, what would you say if you could add in some like practical steps with minimal resources, that would kind of help ease that burden that is there currently there on student caregivers?
Well, I find, and there's actually there's some colleges. I did a presentation with a colleague last year at a professional organization for student affairs,
Mm.
and we looked at some schools that have some caregiver programs going. Speaking of coughing, here comes one now. But I think whether it's higher education or the workplace, I think where people connect to caregiving is if they know of someone who's been a caregiver,
Mhm.
or they've been a caregiver themselves. And of course, since the number of caregivers in the country is increasing,
Mhm.
um, that's becoming more you know that that's becoming more common.
Mhm. Mhm.
So I think introducing that, and then tying that to student success and student performance, because we're college students or even youth, because we're talking about college students here, but they're youth caregivers. They're people in high school, there are people in elementary school who are helping care for a parent.
Mhm.
They've got some responsibility. They go to school, but they come home and they have to sit with mom or help with dad's medication, or whatever it is. And they caregiving affects class attendance,
Mm.
affects ability to get assignments done, in addition to the health of the students who are caring, their mental and emotional and physical well-being. So tying that to student success, because colleges are very, of course, the whole purpose of college is to get people to graduate, get degrees. So
Mhm.
tying the the caregiver experience, and there are other things that students face, like food insecurity impacts it. Homelessness, students, we have students who are homeless but are trying to attend classes. Showing them the connection between all of those things and student, and how it affects student graduation rates and outcomes, is the key to that. And there are things that colleges can do, and it's interesting. I just had a conversation last week in a meeting about things that can be done. One easy thing is an intake survey. At the time a student enters, and have a question on it that relates, are you helping take somebody to the doctor? Because oftentimes, sometimes if you use the word caregiver, they won't necessarily connect with that. But
Mm.
are you helping somebody who has a health issue? Would be good, which is the easy way to identify it. And then a thing that doesn't require really any resources would
Mhm.
be a peer support group, because for
Mhm.
college age students, peer on peer, we use peer on peer, support for lots of things.
Absolutely.
So that's something that doesn't really cost any money. You just have to get it organized,
Mhm. Mhm.
and then that would help the students to feel supported in their journey, by having somebody who could relate to what they're going through.
Yeah.
And awareness. That's the other thing. Helping faculty and staff on campus to be aware that student caregivers exist, and this is what happens, and this is what they're going through. So if somebody comes into their office and discloses that they're caregiving, they're a caregiver for somebody,
Mhm.
will be able to give support to them in that journey, and whatever it is, because it's all kinds of stuff. I mean, students are having to work to help people pay for medications. It's all kinds of things. So yeah.
I mean, said so many great things there in that little bit, but it's, you know, I feel like once a caregiver, always a caregiver, sort of like you kind of develop the heart for it, and then it becomes a part of you because it's such a huge part of someone's life when you are like a family caregiver. And um, there's also stigmas that are involved with it as well. And until we as a society don't work hard to remove these stigmas and, kind of like begin to accept and understand this is like a, a natural part of life and as a thing that is not nearly supported enough, which is why there are probably like roadblocks and things like that in place.
Mm-hmm.
But to me, the thing that's, like support groups, you mentioned support groups, and that's something that is so, so important because caregiving is such a lonely world. Like a lot of the times caregivers will feel isolated from the regular life and social groups that they were with. And it can feel it's really isolating, and like loneliness is a huge epidemic that's going on across the country right now too. So we don't need to be further contributing to that. And there are such amazing community resources in place. I know that there will be a caregiver support group in every single community. You just, like you said, you just have to go look for it and sort of find it and, get connected with the people that are going through similar experiences as you, because that is therapy. Like that is something that will, only contribute to you and your caregiving journey positively. And so I think that that's really cool. Aspect of like community building. And then on one last thing, you mentioned that the population is aging really, really fast,
Right.
which means that we're only going to need. Actually, I've like been doing research on some like numbers and statistics, and this fact has just kind of been sitting with me, and that's that right now the ratio of middle-aged individuals to older adults in the United States is 7-1. By 2030, that ratio is going to be cut in half and be 3-1. So that means that there's going to be even more family caregivers, which makes it even more important to kind of put those supports in place now before it becomes an actual problem.
Mm-hmm. Absolutely, absolutely. And another point I wanted to add about youth and young adult caregivers, they're still in the process of developing emotionally and mentally,
Mm-hmm.
and that is a serious has a serious impact on their ability to do that because when they're caring, or it can,
Mm-hmm.
because they're, and you mentioned about their peers or feeling differently, or wanting, not understanding, thinking that their age group, their friends aren't doing this. They
Mm-hmm.
feel separate, and they feel left out, or they feel strange because they're not into this. So having people to relate to that, if you get peer support groups going, that gives another place for them to relate to that and help with their development. So yeah.
Totally. I completely could not agree with that. And, again, speaking of like development and like, using these things to kind of, maybe life experiences and soft skills, quote unquote, as you were mentioning before, to kind of like continue to upskill yourself. How can we as a society just reframe caregiving so it's seen as leadership experience and other, experiences rather than just like a barrier or like a resume gap, quote unquote?
Oh, well, I mean, you're managing things when you're a caregiver. You're leading things.
Mm-hmm.
If your loved one has multiple doctors, if they have, home health aides coming in, if you're, managing their finances, those are all leadership activities.
Mm-hmm.
You're leading. You're basically project,
Mm-hmm.
managing. So put those skills down, case managing, you know, coordinating services, all those things are stuff that you can put on your resume. And I'm a big advocate of, if you were caring for somebody, or even if you were, a parent, whatever, don't leave that as a gap on your resume. Put the skills down that you utilized, in that, so that you can, and show how that you could be effective in the workplace, doing the same thing.
Mm-hmm.
So that's how, I mean, even when you're a student, whether you're, a working, or not a student, you can utilize the skills that you get as a caregiver in the workplace
Yep.
and demonstrate that. So yeah, definitely.
I couldn't have said it better myself. It's,
Yeah.
it's true like experience and leadership and 75 other things that you could list off, and use those action verbs, put it on your resume, and
Yeah.
make a whole little section about it, because
Right.
why the heck not?
Right. Exactly.
Yeah, absolutely. So I social workers, I like to believe, are sort of the unsung heroes of our healthcare system, as well as a lot of the times they're kind of described as like a bridge in
Mhm.
our healthcare system too. So, what are some things that healthcare teams, like you were mentioning before, can learn from the social work practice? And like, I mean, I guess social workers are a lot of times part of healthcare teams, but yeah.
I would say to me, the biggest thing that social work encompasses a lot of different things and has a code of ethics that guides the profession. But I feel like one of the biggest things that social work brings to anything, whether it's healthcare or anything, is advocacy. And a
Mm,
lot of times in healthcare, you don't have patient advocacy a lot. You
mm,
can't rely on necessarily the practitioners to be in that role. And there's so many different components of it. Again, we go back to insurance and all these different things. Social workers will bring the advocacy piece to any team to make sure that the client, the patient's wishes are, heard and understand, and people are advocating for their family members, because a lot of times, unfortunately, I would love it if it would get better, but um, the caregivers aren't always included in healthcare decisions. They don't. Doctors and other professionals don't always feel the need to, include them in that. So
mm.
social workers can, ensure that that happens,
Yep.
as well. And then, of course, the other piece is the social justice and equity piece,
Yeah.
where they're assuring that, everybody has access
Mhm.
to what they need, or at least they can, push for them to have access. Social work can go into the policy space of, on that side, trying to ensure that policies are fair and equitable, and resources are fair and equitable. So that's the biggest thing that social work brings to that, you know.
And I'm really glad that you mentioned that, because I know you do a lot of advocacy work and, caregiver equity and just like equity in general when it comes to these things. So I'm going to jump a little bit ahead here because,
Okay.
you've mentioned it, but you kind of just like went into this of how caregiving does intersect with equity. But who's getting left behind, and what can our systems that we have in place do, and what new systems can we put in place to kind of close these gaps? Like, what can we start doing to really make sure that this is not like an equity issue anymore?
I think it's because it's so tied to healthcare. I think we have to deal, excuse me, with the inequity in healthcare,
Mhm.
in order to deal with the inequities that are in caregiving. Because
Absolutely.
I mean, if you, a simple one is rural communities versus big cities, and, for a lot of people, Georgia, I mean, what Georgia is Atlanta, but there are plenty of rural communities that don't have, health care, close, hospitals and doctors or specialists. And that's something that definitely needs, to be addressed,
Yeah.
improved, and in order to be able to, address the needs of caregivers, because, if you have to drive, and I've heard of cases where this happens, depends on what you need. You may have to drive an hour and a half away to get like a memory assessment. Like, that's not acceptable for
Sometimes even more.
adults. Right, exactly. There's tons of reasons why that's not acceptable, in terms of just the caregiver journey. I mean, the time it takes to do it, the excuse me, the
Oh,
time.
you're good. Take a sip of water. Like I said, you guys, trooper over here.
Thank you. Mm. The time it takes to get the assessment, um, the time it takes out of them being able to do other things, all of that
Hmm. Hmm. I.
is yeah, is important, is, plays into that.
Mhm.
It factors in.
Aw,
Hold on
that's
a second.
No, you're all good. What we can go ahead and do is there's a couple of questions in the audience as well. What I might do is I'll pick one of those that we'll go ahead and answer, and then maybe I can email them over to you if you have
Okay,
a few minutes. Just like type them back out, and we can respond to them in the comments
sure.
because I'm super excited to hear what you're saying. And I'm gonna ask one last question from myself, and then we'll do one more audience question, and
Okay,
we'll just go rest that voice of yours.
okay,
Um,
thank you.
of course, of course. So I think the one that I want to go ahead and do it because I know, I mean, as
Mhm.
you know, we have, dozens of thousands of student caregivers nationwide who are in a different they're taking on a new definition of student caregiver, of uh,
Right.
you know becoming that respite for family by also gaining some valuable experience that would otherwise be difficult to learn in a classroom. Companionship care services to older adults in their communities, and also upskilling themselves as future clinicians and healthcare workers. So, um, so students at Carrie are often going to be nurses, doctors, and social workers, just like yourself. So,
Hmm.
maybe what are some tips that they could start using that, and what can we do to ensure that they're not just prepared clinically, but also emotionally for the journey that lies ahead?
I think that's one good thing about Kiryaya because it gives them exposure to being at someone's bedside
Mm-hmm.
because you can't know what that's like until you do it.
Mm-hmm. Mm-hmm.
So for people who aren't a part of Kiryaya, volunteering in places where you think where you want to work would be good because there's nothing like, and we see this. I'm at a health college, so but we see students who are really passionate or think they're really passionate about um, being, whatever it is, respiratory therapist, nurse, whatever. But then they go to the bedside and it becomes a challenge. And because there's so many things you have to be, remove yourself or be selfless
Mm-hmm. Mm-hmm.
in the process.
Absolutely.
And
And
um, it takes practice, to get that skill. So, yeah.
it really does. And that's where I think, it all kind of comes full circle because you mentioned soft skills at the very beginning of this. And I think that
Right.
that's something we don't do nearly enough in, higher education or just gen ed in general,
Right.
upskilling people in, because that's something. Skills are things that can also be taught. Um,
Hmm.
and we could use classroom spaces to teach things as well. I mean, of course, you're going to learn it through practical life experience, but um, we could do a better job as a whole of kind of incorporating it more into like a holistic curriculum and
Yes.
allowing people to come out as like a more like well-rounded professional in general, whether they're going to be, a healthcare administrator, a social
Right.
worker, a doctor, or even like I don't even know, like a computer scientist. Like I feel like those things will always come in handy. But we do have a question here that I'm
Okay.
excited to ask. Patty is wondering what you think would have surprised your younger self the most about the work that you're doing now. Oh, I like that question.
Give me a second.
No, take your time. Off the cuff here.
I know. Let me see. I think, well, see, my younger self was set on, I thought I wanted to be a therapist.
Mm,
And once I got exposure to it, I didn't want to be a therapist every day. Did not want to do that. So I think the fact that I was able to, and that's one of the things I love about social work,
mm,
is that it gives you, there's so much flexibility about where you, social workers work in all different kind of settings.
yes.
Like they work, because one of the big ones now that I find so interesting is sports social work. Like they're social workers working with like NFL teams now to
Okay.
counsel their, yeah, it's a new thing. They work that, the social responsibility in corporate America. There's so many different spaces. So that's one reason why I'm glad I chose this
Yeah.
profession. So I think what my younger self would have been surprised that this is what I ended up doing, period. Because my younger self, I literally got a certification in school social work to work in the school system. And then before I even finished my practicum, I decided I knew I didn't want to do it.
You were
So
like, nope, this is
yeah, I
not
was
me.
like, nope, not doing this. No, I'm not. The truancy thing was not my thing. So I just didn't. I didn't do it. So I think, and Maggie, thank you for that question too. I think that's what I would be surprised that I learned, because I thought I wouldn't be doing anything like this.
Right.
So yeah.
That's so interesting too. And like, I mean, there's like, just like you said, social workers, like when people think social work, they're like, oh, like child protective services,
Hmm.
like that. And it's maybe like 5% of social workers.
Right.
But it's so expansive, and something that is a super versatile field, and there's a million and one things that you can do. And what you're doing is really unique as well, because that's not something that's, I mean, I guess like student caregivers aren't even talked about nearly enough. So that's why the work that you're doing is so important, and the advocacy. But yeah, do you feel like you can do one more question, or how are we thinking?
Right now we seem to be calm with this coughing, so let's do
All
another
right,
one.
let's do it. We can keep it quick. I like this one too. We have a question about, given the growing shortage of healthcare workers, how can we as a society work to make it easier for young people to pursue health professionals? This is a age-old question that we've been trying to figure out here at Carrie.
That's a good question.
I think there's so many barriers that are in place,
Yeah,
especially when it comes to like the cost of
yeah,
education.
yeah.
Because a lot of the times there's so many people that will go into college wanting to pursue a career in healthcare, like a freshman
Mhm.
who's pre-med. And most freshmen who are pre-med actually end up pursuing a completely different career path. And
Yeah.
we have to, as a society, kind of think like, what is it that we're doing that's like kind of taking the dreams of these people away? And like, what can we do to kind of give these dreams back to them?
Yeah, I think definitely just in general, the cost of healthcare and the cost of education, period. And the thing about healthcare education, let's get out of my college, period. Think about going to medical school. I mean,
Yeah.
it's expensive. So, it is. And so we've got to create um, more ways find ways to make that more equitable, more scholarships, or programs where the students can, like, there has to be some way to make it more accessible for
Yes.
people and cheaper. But here's the other side, from the education side, is running healthcare programs is expensive,
Hmm.
cheap. Like, I mean, some of the, it's extreme, like lab space, and the accreditations that we have to, it's not cheap. So it's different. It's going to take looking at different ways to make it less expensive on the schools,
Hmm.
um,
Hmm.
and more, and there's not an easy answer for that easy
Right.
either. I'm like, sometimes it's the profession that might have to advocate for more resources,
Mm.
or more scholarships, or more, assistantships, or things, depending on what level of education you're talking about,
Yeah.
in order to help pay for it. But I mean, that's and in fact, it's probably is a more conversation for the individual professions to
Right.
see how they can make it, because it's not, like I said, to the school's point, it's not cheap. Like, I mean, we thought about starting some new programs that have to be accredited in order for the people to get licensure, and they're thousands of dollars, to get off the ground. I mean, the number of resources, and that's one of the problems where you see it, like, for, schools, if you don't have access to your own medical center, which most of them don't, or a hospital,
Mhm.
you don't have enough clinical sites, and where you're going to get them from. And I mean, it's a lot of consideration. So I think it's something that the professions may need to look at, in
Yeah, that's
order
a good
to
point.
look at different ways to get more people in there, because the schools just don't and aren't going to have the resources
Mhm.
to necessarily do it by themselves. So
That's the thing, like really investing. But that's something that I feel like we sometimes miss out on, is like investing in something for the long-term return. Because, maybe I don't know, I'm just like thinking random things right now, but what if there was like a program where people from pre-med people from underprivileged backgrounds who would not be able to like pursue a career in healthcare otherwise, are part of the scholarship program, or where once they become a physician, their education has fully been paid for. They're expected to, at some point in their life, to kind of return the favor to another pre-med student down the road, kind of like support their education and becoming like a physician or something like that. Like that, like community-based things like that, I think would really be helpful in bringing these things together. And I do think that, you know, we can ask more of our government. Like we can ask government to kind of like do more in like subsidizing these things, because it's, you know, there's at the end of the day, like we're going to be in trouble if we don't have enough like we don't have enough geriatricians. We don't have enough.
No, we don't.
We don't
And you've got to get down to the geriatrician point. We're going to have to get young people interested in that branch of medicine, because they don't want. We partner with Grady Health System on a project for one of their teen programs, and when they come to Grady, and if they're interested in pre-med, all of them want to be anesthesiologists because it pays the most. So getting them to be interested in something that's not just financially driven about how much money they're going to make is key too. So
yeah, that's such a good point. I mean, it's about exposure too, though, because I didn't even know that geriatrics was like a field. I just was like, oh, it's family medicine, you know. But like knowing that exists is really cool, because like, and also allowing more exposure in medical school. Like there should be a geriatric rotation that's not just like, you know, a 4-week thing that they shove in there every once in a while because someone is telling them that they have to. But it's like something that should be like more of like a conversation, because again, our population is aging faster than we can handle, and we got to do something about it.
I agree. Also, helping young people to understand older, like age, aging. They've got to, helping them to see people who are older than they are are have value, because I think that's part of it. Is they don't want to do it because heck, people like 10 years older than them are old to them, but helping them that, aging is a process that we all have to go through, and you're going to continue to have value until you're not here anymore. And I think that's part of it, because they don't want to. That's part of they don't want to treat old people. You know what I'm saying?
And that's because we don't talk about it nearly enough. Because aging is scary. Aging is this big bad thing that you don't want to do. But no, aging is beautiful. Aging is a privilege. If you don't age, then you die young, and no one wants to die. So it's as like our media and our society can do a better job of portraying aging as a natural part of life that you should be excited for. I'm telling myself this too.
Exactly. Well, everybody does, because as you get older, you're like, oh Lord, but you have to, but it's again, the images we see, the messages we get, it's a blessing. There's plenty of people who don't get old because they don't make it to, 30 or 40 or 50 or whatever the age is, much less, our senior community, they don't get that far. So if you make it that far, then that's a blessing, as opposed to, looking at it like, oh my goodness, I'm getting older. Thank goodness you're getting older, because a lot of people didn't get a chance to do that. So
100%. Absolutely. Well, Miss Felisha, I can talk to you for another 2.5 hours, but I know that your throat was not like that.
No, it would not. It would probably, I would love to be able to talk more. I'm so grateful for the opportunity to have been on the podcast.
I appreciate you
and your patience with my coughing.
Please, oh my gosh, you're perfect just the way you are. And what maybe we can make a promise that one day we'll continue the conversation, and a few months down the road we'll have a part 2 of the podcast and keep talking.
Absolutely, I would love that. I would love that. I have fantastic time as usual with you.
There's so many cans of worms that we still got to open. Yes. But again, thank you for being here, and thank you everyone for the questions, and we will see you again very, very soon.
Okay. All right. See you later. Thank you. Bye-bye.
Of course.